Welcome to Introduction to Pharmacology. The objectives for this unit are: define pharmacology, describe what a drug is and explain the difference between a therapeutic effect, a side effect, and a toxic effect, identify the importance of drug safety, describe how drugs are named, and identify common resources for drug information. So what is pharmacology? Pharmacology comes from a Greek word, pharmakon, and pharmakon refers to drug or potion. As many of you have learned throughout your education, ology refers to the study of. So, hence we get the word pharmacology, the study of drugs. The next question is, where do drugs come from? There are three main sources from where we acquire our medications. The first being plants. Many of the first drugs used by humans were derived from plants. One example of a drug that we still use this day is called digitalis, and that comes from the foxglove plant. Second source for drugs would be animals. Animal-derived drugs come from a variety of different places or organs in the animals. Heparin is a commonly used medication, and it's derived from the intestines of pigs. And then the third source where we primarily get medications from are synthesized medications. And many of our most current drugs are developed in this way, whereby they are created through a chemical combination in the laboratory setting. Drugs are chemicals that have many different effects on the body. You may have noticed I've already started using the terms drugs and medication interchangeably, and that is perfectly acceptable to do so. The therapeutic effect of a drug, as you see on your left here, is the desired effect of the drug on the body. It is what we want the medication to do when it is inside the person's body. On the right-hand side of the screen refers to undesired effects. These can be categorized as side effects, adverse effects, and toxic effects. These different effects escalate in danger to the patient, with side effects being the least harmful and toxic effects being the most dangerous. Generally, side effects are a nuisance, but can be tolerated in most cases. Maybe an itch or a mild stomach irritation could be examples of side effects. An adverse effect could be harmful and might require discontinuation of the medication. This could be hives, nausea, vomiting, and diarrhea that doesn't want to go away, all of which, if they continue, could be harmful to the body. Toxic effects are poisonous and deadly. If a patient is experiencing a toxic effect, the medication must immediately be discontinued, and additional measures may need to be taken to stop or reverse the toxic effects to the client. Okay, time for a short review of the topics we just talked about. So what is the term for the intended effect of a drug? The answer is the therapeutic effect. An effect of a drug that is a nuisance is a side effect. An adverse effect is an effect that could be harmful to the patient. And poisoning by a medication is also referred to as toxicity. Did you get it? The FDA, the United States Food and Drug Administration. Our next topic is drug nomenclature. Drugs are known by many different names. The chemical name refers to the chemical structure of the drug. The generic name is a shortened version of the chemical name. And the trade name, sometimes also called the proprietary name, is a name that's chosen by the manufacturer that's going to be used to market the drug, to make it appealing and sellable. Drugs can also be classified as prescription or over-the-counter. OTC is the common abbreviation for non-prescription or over-the-counter medications. Prescription drugs require a script from the doctor, whereas over-the-counter medications can be purchased without a physician's approval. These are the things you usually walk into your local drugstore and pick up off the shelf. Okay, so we discussed how we come up with drug names. I have an assignment for you. I want you to look at the picture to the right of the arrow and answer the following questions. You're going to need to find out what the drug's chemical name is, what the drug's generic name is, and what this drug's trade or brand name is, also known as a proprietary name. When you figure it out, send me an email and I'll let you know if you have it correct. Okay, so I gave you the problem before I gave you the tools for the solution. That's where drug references came in. Drug references are important tools for allied health professionals. Each reference contains specific information about drugs. Selecting the appropriate reference is the key to efficiently finding out the information that you need about your medications. I've listed 5 different ones that you can start to use and look at during this course, but of course there are many other references out there. The first is called the PDR, otherwise known as the Physician's Desk Reference. This is an annual publication, and it's that big giant blue or red, depending on the year, book that you will see sitting in your doctor's office on the shelf. It contains basically all those drug inserts that when you get a medication, all that stuff that's in it on that piece of paper. Well, all that is compiled and put into the PDR each year. So it contains everything that the manufacturer puts out about the medications. It also has a table in it that shows you pictures of medications to help identify them, and it lists them by their generic name, by their trade name, or their proprietary names. So it's a very useful tool. It is big and it is bulky, and as I said, it is printed every year. The second one I have listed here is the Drug Facts in Comparison. This is a loose leaf index. As a result of it being loose leaf, pages can be put in and taken out frequently. When someone elects to use this as a reference, they actually subscribe to Drug Facts in Comparison, and as new updated information comes out, the new sheets are mailed to you and they get placed in the binder and old sheets can be removed. So it's actually probably one of the most current drug references around. Generally, some of your larger physicians' medical practices may have these, and hospitals you will find these in, but they're not, because of the cost and the constant upkeep of them, you don't see them very readily in smaller medical offices. The third one I have listed for you is the United States Pharmacopoeia National Formulary. This is the official drug list of the United States government. It is revised every 5 years. So the first year it comes out, it's pretty up to date, but by 2, 3, 4 years down the line, there's a lot of other medications or changes that may have come out to it. But again, it is the official list of the U.S. government. Nursing drug references are also on here. These are basically like your Reader's Digest version for medications. They contain information specifically geared towards nurses and clinical applications. So you're not going to find the details on the chemical makeup and that you do in the above references, but it's smaller and it's very practical for on the job looking up of medications and what you specifically need to know to be administering and monitoring patients who are taking these medications. Generally, they are updated again annually, and there are a number of different companies that put these references out. The last piece I have on here is internet resources. There are many, many, many internet resources out there for looking up medications, medication information. The main thing I want to let you know about this is make sure you are looking at a reputable source. Some of the ones that you'll see referenced in here in the RX list, drugs.com, PDR Online, which is the above desk reference but in an online version. They are some good ones to use. Avoid using ones that are backed by, Cosmo or magazines and those type of things. Just make sure that if you are using an internet resource source, you are using a good, reputable resource. It's going to give you the most current information about your medication. I spend so much time going over this because understanding the information that is in each reference is crucial to being able to select the correct reference for the information that you need to find. It'll save you time and energy in the long run as you become familiar with medications and finding out more information about medications. That concludes this section of Introduction to Pharmacology. Do remember, you want to go, if you haven't already done so, look up the information about the medication that was presented in this section and email me the answers to the 3 questions.